I am Annette Matthews and I'm here on behalf of Shop Beautiful. I'm very excited to be so. We have, quite a lot of information in store for you guys just over the next hour or so. We will have a blog that we're going to kind of as alongside this to put it all together. And I think the guys are recording this and it may be on their YouTube channel at some point in the near future as well. So it's kind of coming up to the summer months or spring months, and pigmentation, we may be seeing more of it. We may have had individuals that have had a downturn in their skin condition during the pandemic, and we may have things like post-inflammatory hyperpigmentation occurring more so as well. So what this evening is about is just to kind of cover the different variants of pigmentation and in consideration of and go through those things really, and the sort of treatment plans that we can think about, the sort of treatments that we can think about utilizing, the sort of products that we can recommend as well. So that's basically what this evening is going to be about. So let's make a start, she says, clicking the button there. So aims and objectives, we're going to, as always, refresh on the anatomy of skin. That's where we always start. It's very important to start at the beginning, as always. We're going to be looking at pigmentation and its etiology. So what causes pigmentation? How and why is it there? We're going to enlighten you guys in ways of professionally treating this. And you probably already do this with products that you have. So I'd be intrigued to kind of learn about how you deal with pigmentation at this point in time. And home care as well that can help with pigmentation, with some top tips for skin health, most of which you will already know, but just refreshers obviously, and obviously the home care and professional considerations that we can consider as well. Okie dokie. So have we all had an amazing week back? I know it's literally been like a baptism of fire for me at my clinic, and I am chasing my tail, which is amazing. So I'm not complaining about it one bit. So I do hope you've all kind of just settling in, finding your feet, lots of new clients and clients coming back through, and yeah, just kind of enjoying yourself back into it and doing what we do best. So who am I? I'm Annette Matthews. I have a skin and aesthetic clinic over in Wirksworth, Derbyshire. My background, I'm actually a dental hygienist and a dental therapist, but I absolutely have a proper affirmation for skin. I'm a self-confessed skin geek. I don't know about some of you guys, that's why you're here with me this evening probably. So I got into aesthetics and skincare around about a year, no, it was probably the same year I graduated from university from dental school. And I just kind of fell in love with it from there. So my aesthetic clinic's been open about a year and a half, but I've been doing aesthetics since 2013, aesthetics and skincare. And I've just started this year on a master's in cosmetic medicine and skincare and aesthetics. So that's all very, very exciting. And I'm here to kind of share that journey with you guys as well, and that information, so that we are all offering the best that we can to the clients that we have in front of us. A little bit about me, and my clinic is called W Skin, so do check us out. So, functions of normal skin. We should know this already, but just a brief refresher. It's a mechanical barrier, it's a chemical barrier, it's going to help prevent fluid loss. We use overlapping cells and this lipid layer that we have on the top of our skin that prevents something called transepidermal water loss. So we need the moisture in the skin for both hydration, to act as an antioxidant, and to protect the skin as well. We need to minimize the amount of water loss, and that's what that lipid layer, that barrier protection, will do. We have defense against microorganisms, immunological barrier. It's an endocrine organ as well, so it can actually produce its own vitamin D under UV. So it's its own endocrine organ, much like adipose tissue and fat within the skin as well. Melanin protects against UV. So that's what we're going to be focusing on this evening. So melanocyte, melanin, pigmentation, and all the things that go with that. Thermoregulation, so obviously it's going to vary our blood flow. When we are hot and we are cold, our blood vessels will dilate or constrict, and that is what allows us to kind of regulate our temperature as well. And of course that sensory organ, so we touch and feel with our skin as well, and all of that has an impact. So pigmentation refers to the colouring of the skin. Skin pigmentation disorders cause changes to the colour of your skin. Okay, so melanin is made by cells in the skin and is the pigment responsible for your skin's colour. Hyperpigmentation is a condition that causes your skin to darken. So we are going to cover kind of conditions and things that we might see in our daily do anyway. But what sort of things do you see now, guys? Just kind of tell me in the chat. I'm not sure how interactive it is. I always kind of feel a little bit anxious when I ask people to talk to me. But yeah, tell me kind of what do you see now in your clinics? Talk to me, tell me. So let me think what I've seen this week. I've actually a lady in for dermaplaning this week, and she'd got vitiligo. I was doing a training course with a delegate of mine, and it was really good actually, because it was a good little tester for her. And I said, okay, so this client's come because she has an uneven skin tone. Do you think we can help her? And obviously she did identify that it was vitiligo, which we're going to talk about this evening as well. So primarily, a lot of the pigmentation that I see is post-inflammatory hyperpigmentation. So Bali, yeah, you just mentioned acne and lots of pigmentation. So with the likes of acne, we have something that occurs called post-inflammatory hyperpigmentation. And we're going to chat about that a little bit more as the evening goes on, but that's a very common situation that I come across in my clinic. I have various clients with melasma, and again, we need to have a good understanding of that when we're treating it and manage expectations with that one as well. That's a really good one actually, Bali. The darkening of skin from ingrowing hairs. Yeah, so that again will be your post-inflammatory hyperpigmentation. When we have an ingrowing hair, we get that inflammatory marker, it gets swollen, it gets red, it gets inflamed. And that is in effect what is upsetting these melanocyte cells. And that's what implements that purpley, reddish, horrible pigmentation that we can see after such as that. So yeah, that was a really interesting one. But I tend to see, you know, more than anything, your post-inflammatory hyperpigmentation cases. And, you know, what's interesting is if we choose the wrong products and choose the wrong treatments, as we know, we can actually induce post-inflammatory hyperpigmentation. If they're following poor aftercare with the treatments that we provide, that can actually induce post-inflammatory hyperpigmentation and pigmentation. So if we've done peels, if we've done microneedling and they're not protecting their skin, that could induce some form of pigmentation as well. So that's why having a good understanding is so important for us, and it must not be neglected when we're thinking about training as well. So here is your melanocyte. So it's a bit what we call a dendrite cell. So these dendrites that come off it, these little arms that come off it. And your melanocyte produce two chemically distinct types of melanin. You've got your brown to black eumelanin and the yellow to red pheomelanin. Okay, don't panic about this too much. I just want you to picture what creates your melanin is a bit like this. It's a bit like a star dendrite cell that sits right on our basal layer here. So have a little look at this image here. So you can see the skin, the layers of the skin here, the live part of the skin, and the dermis, which is here as well. Okay, so at the basal layer, so where your dermal to epidermal junction is, the basal layer, you've got these little alien looking dendritic cells that sit along here. Okay, so amongst your basal cells, you've got your melanocytes. The melanosome is an organelle found within our cells, as we know, and is a site for synthesis, storage, and transportation of our melanin. Okay, this is the most common light absorbing pigment which we find in the animal kingdom within mammals. Okay, so melanosomes are responsible for color and photoprotection in animal cells and tissue. So they provide the color of hair, eyes, and obviously skin as well. So this is an image that I really, really like actually, because you can just, I know it's a cartoon, and when we're looking at these, it is a struggle, because when we look at the skin, it doesn't look like this, but this is what you need to envisage underneath. Okay, so these are your dead keratinocytes. This is what we are actively trying to delaminate naturally, but also remove with the likes of chemical peels and exfoliation, that stratum corneum layer. Underneath that, we have a whole host of things going on. So the very bottom there, the basal layer, so that dermal to epidermal junction, so where the dead skin meets the live skin, ultimately, we have this basal layer that sits there with these dendritic cells. And these arms kind of work the way up and around our skin cells. And these are, it's melanocyte, this cell here, that releases the melanin and kind of seeps it out in between the cells, okay? The reason it sits here is for protection. So our DNA sits below this. And what the melanocyte is doing is protecting our DNA and our everything that we need to actually function. Okay, so when we have something that's hitting the skin that's causing damage, such as a UV ray and or pollution or environmental triggers, our melanocyte thinks, hang on a minute, okay, I've got to protect us here. I've got to produce more melanin. I've got to defend these skin cells and protect my dermis, and that's why it releases the melanin. In the instance of post-inflammatory hyperpigmentation caused by acne and things intrinsically, such as hormones as well, we have this melanocytes that's upset internally. So if you've got inflammation from the basal layer because of bacteria that's in the dermis, so below it here, that's going to upset the melanocyte as well. So it's all about keeping Mr. Melanocyte really, really happy, and keeping him happy or her happy by, you know, good lifestyle choices, good intrinsic measures in terms of skincare, diet, lifestyle, all of these things. And obviously preparing our clients, if we are doing procedures, they need to implement good regimen and home care as well. Okay, so that's how you want, and that's how I need you to envisage this dendrite cell, this melanocyte that's doing what it does. The most studied melanocyte function is the production of UV radiation protective melanin pigments. And it's this that is delivered to the keratinocytes, the other cells in the skin, as a form of protection, okay? Melanocytes have been shown to deliver both pigmented, the melanosomes, and non-pigmented vesicles to keratinocytes. So we're releasing pigment and non-pigment at the same time, but it's all as a form of protection, okay? So does skin tone matter? Fitzpatrick type, hopefully you're all familiar with the Fitzpatrick type for skin types, and it depends on the procedures and treatments you are doing. But we should all start to be looking at our clients and kind of working out and recognizing their Fitzpatrick type, even if you don't offer these sort of treatments, you know, like the likes of chemical peel or needling, that are super important when we're doing this. So Fitzpatrick types, as you can read on here, generally, obviously, the darker the skin type, the higher the number. So usually your range is 4 to 6. They have longer melanocyte dendrites. So remember that cell with all the arms coming off? If they're a high Fitzpatrick type, they have longer dendritic cells. So that means there's going to be more pigmentation, not more melanocytes, but more pigmentation that can be produced and pushed in between the skin cells, giving that individual their color. Darker toned skin will carry more black or brown pigments, and that eumelanin that we talked about. So 2 different types of melanin. So the darker one is carried more in those with darker skin tone. The size of the pigment granule is larger in darker skin tone. So I once heard somebody say to me that there's more melanocytes, and that isn't the truth. The truth is we've got these dendritic cells that are longer. We've got a larger granule of pigment that is within the skin. And the actual size of the melanosome is larger in darker skin tone. So that is why we see a darker skin tone in those individuals as well. The amount of pigment is the same in all skin types. It's how, you know, it's kind of that tomfoolery with, you know, with colors and how we see it in a different skin type because of the genetic makeup of it. So it's larger and more longer dendritic cells. So when we're treating the Fitzpatrick type 4 and 6, we do need to be wary of treatment options and the sort of things that we are considering. Not so much with home care. Well, we do need some consideration of home care and the things that we shouldn't be using. But more than anything, it's your professional treatments like your chemical peels, your microneedling, and those things that we rely upon getting into the dermis for that active regeneration of the skin. Okay, they're the ones that we need to be wary of. And obviously follow protocols and follow guidelines set by the brands. My training this evening is not branded. I try to make it not branded. I make it more educational. That's really important to me. I don't want to kind of just come across as somebody that just talks about, you know, the same brands all the time. I want you to understand that there are lots and lots of products out there with great efficacy. It's down to us to work out the ingredients and what's best. And that's coming over some webinars in the next few weeks as well. So we're going to think about the skin now. I love this diagram because it kind of spins around and we can just kind of envisage your skin a little bit more. And I'm going to demonstrate to you where these melanocytes, you could probably point out to me now, hopefully. So along this basal layer here, this is where our melanocytes sit. Okay, so it's that dermal to epidermal junction. So there's your epidermal section. This is your dermal section here. Dermal to epidermal junction. This is where our melanocytes will sit along. Okay. alongside our basal cells. Sorry, we've got a repetition on there. So yeah, I mean, there's a reason I put that in there. So the functions of a normal skin, when skin is functioning normally and it's looked after and it's in the best condition it can, it does all of this. When it isn't, and when it hasn't been looked after, and we have poor regimen, and we they may be new to these sort of treatments and offerings, then all of this is not going to function in the best way. So that's what we can help our clients with as well. So vitiligo, that is something, as I say, I've come across this week. I've had individuals message me on Instagram and Facebook as well at my clinic in the past, asking if I can help them. The answer to that is no. There is no quick fix with vitiligo at this point in time, but I do know there are lots of interesting studies going on at the moment with stem cells and other technology as well. So, it's not something that I can offer in my clinic. I try, I don't give them false hope. We manage their expectations. We can help them feel better in their skin. But I would always kind of, direct them towards, as you can see here, the vitiligosociety.org. There's lots and lots of information on there if you do have an individuals that come through. Because it can be quite debilitating if they've got these areas on their face as well. So we definitely want to make sure that they're okay. Make them feel good with the potentially other treatments. Like my lady, she had derma peel and a bit of a facial, and she left feeling really, really good. So that's what matters. Pigmentation, liver spots and age spots. We know this too well. We understand, hopefully, if you've been watching some of my other webinars, there are multiple reasons why our skin ages. The vast majority are extrinsic, but there are a minority that are intrinsic, so something that's happening from the inside. And here lies the likes of acne, which we can't really do anything about. In particular, if, we can do something about acne. That's probably wrong of me to say, but acne is intrinsic, and that can cause that pigmentation, that post-inflammatory hyperpigmentation. But there's extrinsic factors that contribute to acne as well, as we know. So extrinsic factors, so those external environmental factors, UV light being one of them. Pollution is a contributing factor as well. I've been reading papers on blue light. So the first thing we do when we wake up in the morning is we pick up our phone with literally nothing on our skin as well. So it's ever changing, as we know. So it's about keeping up to date with all of that. Post-inflammatory hyperpigmentation, a really interesting one actually that that person brought up in the chat, is from the likes of folliculitis or follicular acne. If they have inflammation of the hair follicle, then yeah, absolutely, that can induce that post-inflammatory hyperpigmentation issue. So that is why it's so important that we get them in a good regimen and a good understanding of their skin health. Melasma, usually brought upon, but not always brought upon from a hormonal aspect, and or ongoing and constant damage to the skin as well, that can induce melasma at the same time. And it is a malfunction of this melanocyte. All of this is, it's trying to protect, it's overprotecting, it's overproducing that pigment as well. The problem you have is once you have a melanocyte, remember that dendrite cell that's not functioning as it should, we can't really do anything about fixing that. And what we can do is just calm it down, pipe it down a little bit with certain ingredients that slow the reaction from the melanocyte down and help keep that skin tone nice and even as well. Okay. There we go. I had some effects as I was talking through that I'd forgotten about. The biggest thing here is prevention. So prevention is 100% key. As always, if we start with prevention, if my 12-year-old uses mineral SPF every day, well, she tells me she does, hopefully she does, we'll find out, because as she gets older, if she is using it every day, like I didn't, then she should have absolutely flawless, perfect skin. So when I was young, it was fashionable to, and it still is, I think, really, have good tanned skin. And I mean, there's no such thing as a good tan, unless it's out of a bottle and it's chemical free and toxin free. But what we know of melanocytes is they're under stress when they become tanned. We come back from a beautiful holiday somewhere, but we've actually put our body under quite a lot of distress, which is why that pigment has come to the surface as well. So prevention is key. So prevention of sun damage with your SPFs. So this is a bit of a case study that I did. I always find this is a great way to kind of talk to you and kind of, you know, talk through the sort of things that I've done in my clinic. And this product that I used on this, again, we're not branding focused. I will tell anybody that asks me, you might already have seen this and or seen the pictures that I've put on certain groups as well. But this is Mary. Mary is actually my sister-in-law. We do have permission to use these pictures. She loves it really. Lifestyle choices. So what we need to consider when we're seeing any client for pigmentation is what changes can they make? Have we got compliance? If we start to implement treatments for this sort of pigmentation, and we've worked out that we can help potentially with this pigmentation, what is she doing that could add detriment to it? So what is she doing that could make everything that we're doing completely, not pointless, but kind of no prevention? Okay, so Mary is a runner. She was out every morning at sunrise with no SPF on, and she has been for some time, and she loves to run all weathers as well. So you can see that broken capillary on her cheek area as well, slight on her nose, you know, slight areas of pigmentation, as you can see, and that was her primary concern. So she came in with this chunk of pigmentation that she really didn't like. Current regime, pretty much non-existent. Okay, so that's where we start. As always, we talk to them about lifestyle choices. We explain to them how and why this has occurred, and we get them to think about home regimen as well. So my background is dentistry. If somebody comes to see me and they want the likes of tooth whitening and or composite veneers, and they want everything to look nice and pretty, it's absolutely pointless me doing that if they are not going to look after their teeth that they have already. And the same goes, you know, for orthodontics and braces. We shouldn't be applying these things, and we don't apply these things if they are not compliant in the first place. I flip that onto skin in my clinic and it works tenfold. So we really need compliance. It's not just about selling the products, it's about really educating them to the background of these products and how they're going to work for them alongside your professional treatments. Current concerns and aetiology. So we've worked out the aetiology, which is what's causing it, and that is lack of prevention, lack of home regimen as well, and these concerns that we have in place, and this poor skin quality that's occurred because of it. So I'm going to ask you guys again, hopefully I'll have a bit more interaction. What would be your current choice of initial intervention treatment choice? So how would you treat that? If Mary walked into your clinic tomorrow, into your salon tomorrow, what would you do? Anybody out there? So there's a few considerations that you can make. Thank you, Sophia. You've said a course of biorepeal. So again, we're not here to talk product specific, but that is a great product. We're going to think about skin cell renewal. We're going to think about bringing that pigment to the surface. What you've learned about the anatomy, hopefully, is that these melanocytes that have produced these melanosomes and this melanin that sits in the trapped areas of the skin. So by implementing a faster skin cell turnover with certain treatments and or home care, there's a little hint for you guys, then that's how you're going to see an improvement from that as well. Okay, so yeah, someone said medical needling, VITC, enzyme peels as well. So yeah, perfect. So peels, skin rejuvenation, skin cell renewal, absolutely 110%. But before that, we start with prevention. We start with mineral SPF. We start with education. We can all do that. So, you know, people that are kind of new to certain procedures as well, you see an individual, they come in, they've got a skin concern, send them away with some SPF and some good quality cleanser. Have a think about their treatment plan and what you're going to do and how you're going to help them. That's a good way of doing it, because you don't then have to have a panic and a meltdown and think about what you're going to be doing on the spot. Take some pictures, listen to the client, really take on board their concerns and how you can help them, and build it as a treatment plan and a package. So with Mary, what did I do? So I'm going to tell you guys now. We looked at the bigger picture. So melanosomes are derived from light-skinned melanocytes, are more acidic and have lower tyranase activity. So tyranase is the enzyme that is produced by, it's basically a signal that's produced underneath the skin. It's this tyranase that then tells our melanin quickly, melanocyte, make more melanin. So the tyranase, when there's too much of it, it's an enzyme that will say, quick, we need more melanin. Okay, so by controlling this tyranase, so you will hear and see products with a tyranase inhibitor in it, because it's stopping that, or it's slowing down that tyranase from telling our melanocyte to make more melanin. Hopefully it makes a little bit more sense for you. Hormonal regulation of pigmentation is crucial. One of the major determinants of pigment in the skin is down to that interaction with hormones as well. So if we are dealing with that, so pre and post menopausal and around puberty, that isn't the time to be super careful with the skin and the treatments that we consider. So less is more. We start with prevention, we start with home care, and then we move into our professional treatments always. So here's an explanation of tyranase after I've just tried to do it for you. It's an enzyme present within our tissues that basically catalyzes and tells us to produce this melanin. It's found within melanosomes and used within the skin. So it basically encodes the skin and it tells it to create this melanin for protection. There are certain tyranase inhibitors. You've probably heard of some of these. I know I have some peels that contain them. So when you're looking at certain treatments and things and products even, ascorbic acid, kojic acid, the tranexamic and the hydroquinone, you know, that for me, they're a little bit old fashioned, but other people may still be using them and getting great results as well. So these are the sort of things that you would be looking for in products that are going to help slow that enzyme down and prevent that pigment. So there's a reason that pigmentation is occurring. Whatever treatment we do is probably going to come back unless we implement something like this on a regular basis, both with home care and or professional treatment as well. Professional treatments. Somebody mentioned microneedling. This can help to reduce hyperpigmentation by breaking up the pigment that is beneath it. Okay. I would personally donate to a pen over a roller. You may have a different opinion on that, but I much prefer a pen over a roller, if anybody asks. We're also then inducing collagen induction therapy. So we're actually increasing the amount of hyaluronic acid that's underneath the skin as well, which is going to add other added benefits to that area and aid with repair. Push those old skin cells to the surface and physically remove that pigment. We're not going to pick it, but that pigment is going to work its way up and out. And as you can see with Mary, we had a pretty astonishing result. And this is from, she had a course of a couple of peels, and then we also implemented some medical needling at the end as well. And she has since reported that some of the pigment has come back because we know it will. You know, we've got these malfunctioning melanocytes. They're not, we can't fix them forever. But what we can do is slow them down with the likes of a tyranase inhibitor. So these are results that we had with Mary that we were pretty pleased with. That pigment that I mentioned that comes to the surface, very, very hard. Told her not to pick it off, okay? Just leave the skin, leave it alone and let it shed, let it do what it needs to do. And that's what happened with the treatment for Mary. So she was quite worried. She was sending me pictures, which is fine. We obviously, you know, we were always acting within our competency and confidence levels. I knew that this was okay. I'd seen it many times before. So we reassure them and tell them that all is good and it will resolve. As you can see, it got really dry and crispy before it fell off. She was actually referred to, some you maybe look at him and think, I haven't a clue what you're talking about. Gold member, have a look on Google. It was some sort of, I think it was on Austin Powers. I don't really know, but that's what she was referred to at work. But then the end results were there and she was super, super happy. We've got better home regimen now. We're more educated about SPF and sunshine and making sure, not just sunshine every day, making sure we are looking after our skin 24/7 and obviously implementing good home care regimen at the same time. Nice and clear now. We've got a little bit of work to do on some other areas, but that's exactly what we're going to do and help with this touch of rosacea she has on her nose as well. So your treatment options are always going to be that preliminary skincare. Start with the foundations. We're going to obviously make sure we're discussing aftercare and downtime in relation to any sort of treatments if we are doing quite in-depth treatment for pigmentation as well. And we need to always be thinking about what somebody already said in terms of the hair follicle and inflammation and hyperpigmentation that can occur induced by us. And that can happen if we've not implemented this, okay? So if we don't tell them how they should be looking after their skin, you know, we do peels, we do needling, and they jump in the hot tub and they've got all the chemicals from the hot tub on their skin as well. It's little things like that. We must make sure that we've got really good, conclusive before and after pictures, and we're telling them verbally, and we have forms to back that up as well that they sign. That they've gone through, they read, they understand, and they know that they have a part to play in this as well. An important one to consider As our ladies are getting older, and in particular, we are talking about ladies for this, not so much gents. With gents, they may have more post-inflammatory hyperpigmentation because of their makeup of their skin and the testosterone levels. But when it comes to females, as they become to that pre-post menopausal age, we will find that the wound healing is slower as well. So that's really, really important if we are implementing fairly invasive procedures with the likes of needling and things like that, because they're not going to heal up as quickly as well. And that's due to the estrogen deficiency. So one thing remember is that prevention is key. Super, super important that we are preventing all of this with the likes of good quality mineral SPF. And we start in there. That's where we always start. There's multiple. I think on Shop Beautiful on the website there is training for the Helio Care brand. So you've got no excuses not to have good knowledge around SPF as well. Really, really important that we are. Every client that comes to see us that we're doing any treatment on, they don't leave us without that on. Skin cell turnover. Remember I talked about this and how we're going to bring that skin cell to the surface. So retinoids, we probably already know how these work, but they're a derivative of vitamin A, considered one of the best in anti-aging. Sometimes beg to differ. It comes in a cream or a gel, and there are obviously prescription and non-prescription retinols dependent on their strength. They're going to help stimulate collagen, maintain your skin's thickness, which is really, really good for certain areas of the skin where it becomes thin and opaque. It can help reduce wrinkles as well. They can be quite harsh to obviously dry skin, so we wouldn't incorporate retinoids if we're doing any sort of invasive treatments. But for a long-term plan and to encourage that good skin cell turnover and clear complexion, retinoids may be a consideration for you when I asked about what sort of things to consider. Vitamins E and C into your skincare routine. They're going to help build collagen and they're going to give you that glowing skin. So vitamin C, ascorbic acid, is going to act as a free radical scavenger. So it's going to remove any toxins from under the skin as well. It's an antioxidant, so important. And vitamin E is going to help with repair as well. You can apply these topically. You can also look for something systemically to take these on board as well. I think Protocol on the Shop Beautiful website, they have lots and lots of different supplements and things for you guys to take a look into, and they even have pre-recorded webinars and bits and bobs so you can look into it in a little bit more detail, so do check that out. AHAs, alpha hydroxy acids, we should know what these are, such as glycolic or lactic. Lactic is the largest, glycolic is the smallest, meaning it's going to travel deeper quicker. Scientifically proven to show improvement in the look of fine lines and wrinkles and that uneven skin tone and skin texture. Kojic acid is your skin lightener as well, and that's really good in certain products for utilizing. Remember that tyronase is going to slow it down, prevent it from making so much melanin. So it's going to help maintain your skin's youthfulness and radiance as well. So your AHAs you can apply professionally, and you can consider getting them to use that in their home care regimen as well. Hyaluronic acid, I mean, who doesn't ever get enough of this? Hyaluronic acid is incredible in skincare, in my opinion, if it's used in the right way, both as a dermal filler, as a skin booster, and as a topical application of treatment. And the fact that when we are doing certain treatments, we are implementing that reaction to create more hyaluronic acid, to bring more hyaluronic acid hydration to the area as well. It's naturally produced in our bodies, one of the major components of the skin's supporting dermis. So it provides that plumping efficacy to the skin. It's an antioxidant, natural antioxidant as well. So we need to be looking for products that contain this. We also need to be looking for products that contain it in a suitable molecule to get underneath into the skin to do the job it needs to do. So it's no good having hyaluronic acid in a form that it's not going to get down and do the dirty work, basically. So really, really important that you look into that with any products that you consider. I know that obviously there are a few, if not all, on the Shop Beautiful website where they have HA in its best form, where it is going to get underneath the skin and do what it needs to do. So when we think about this skin aging, ultimately, we've talked about intrinsic, we've talked about extrinsic, and the reason why our skin ages. We've got the UV rays, we've got smoking and lifestyle, we've got diet and nutrition, We've got hormones, we've got stress, huge impact on the skin as well. The vast majority of which, though, are preventable, around about 90%. So 90% of skin aging is preventable. That's pretty insane, especially how we're all sat here now with the control to actually educate our clients to that. So they won't know this. They won't realize that 90% of what they're doing is having an impact on their skin, and we can help them with that. That's insane. When I tell every client this, you do realize that 90% of what's happened and what is happening is preventable, and this is what we need to change. So if we're implementing good habits from an early age and prevention from an even earlier age with the likes of SPF and good regimen, you know, I mean, when I was a kid, it was face wipes, baby wipes, TCP, Clearasil, and all of that nonsense. Okay, talk about this a lot in my webinars. But if we're educating our clients and their children and their grandchildren, then we're going to see a big shift in the I think in the skincare market in a few years' time, which is good. Prevention to protect and education to help eliminate these early onset signs of aging and these pigmentation. What I use a lot, actually, I was going to put a picture on here, I forgot, is my skin scanner. And you know, wood lamp is very similar. You can use the same, and you can see the previous damage that's been done. So yeah, I've got SPF in my makeup, and I wear this, and you know, okay, let's have a little what job that's been doing for you then. And we can actually physically see that damage that's not quite come to the surface yet, but we can see the breakdown and the amount of melanin that's been produced underneath the surface that we can't yet see, and that is skin damage, sun damage ultimately, and skin damage. So what you can be doing now to correct, hopefully you've grasped some of this. So you've got a good idea. You might already have a good product range that you use and be confident with it. That's great. So we now need to use the power that we have, be it social media, be it advertising, be it email database, however you talk to your clients, use this time to actually teach them and educate them as to how to look after their skin and the little changes to make. Okay, so do some reading around certain ingredients. We do have some really exciting webinars coming up. We're actually going to dissect the skin into layers, and we're going to look into each layer for around about 30 to 45 minutes a week, and really kind of delve into this a little bit better, because I want you to be sharing that information with your clients so they understand the compliance that is down to them as well. They understand their skin as an organ, and that it is more than just what you're going to do while they're in that room with you. It works much like the same as dentistry. You know, it's really, really important to educate them to the fact that these small changes that they make will have a massive impact on their skin and their skin health as well. If you've been on my webinars, you know I always talk about these guys. We are having an absolutely mega week as well. Potentially we have a TV appearance next week as well. You know what, they always tend to drop out at last minute, but very excited about this. And Skin are an amazing charity. If you don't know who they are, do check them out. They have an online accreditation. So anybody working with skin and skin health, in any industry, any healthcare professional, any beauty professional, any hair and beauty professional, anybody that has access to members of the public in, you know, fitness, personal trainers, anybody. So if you've got any partners, friends, whatever on Facebook, tell them about this accreditation. You go online, you do it, and it will help you spot the early signs of skin cancer and melanoma. So yes, we're dealing with pigmentation tonight. We're talking about pigmentation. If somebody's coming with an area that doesn't quite look right, it's been there, it's changing, it's evolving, this accreditation will teach you how to have that conversation with that individual to go and get it checked out and consider things that could be something a little bit more sinister. So important, because as we know, around about 80% of skin cancers are preventable, much like 90% of skin aging is. So the key is in education. So do check those guys out. Health is wealth. Leading a healthy lifestyle can potentially help push back the hands of time a little bit and keep us hydrated and looking good. I always I advise to maintain a good diet, exercise regularly, and avoid smoking. And I implement that myself. I haven't always done, but we set by and live by example as well. It's crucial to achieve all of that before you focus on any anti-aging products. Okay, so if you have clients that come in and it's a difficult conversation to have, but you've got to get them thinking about compliance, home care, lifestyle, diet, nutrition, all of the above really get them thinking about that, to get some good results as well, especially with the likes of pigmentation. Something that has been there a long time and taken somewhat a long time to occur is going to take a long time to disappear, and it's probably never going to disappear, but to be reduced. And that's a really important one, such as like your lines and wrinkles. They are, you know, that they're something that we can do some treatments for it, but there's no quick fix with any of this. Really, really important that we get them to understand that from the off. So it's time to close. I'm just going to ask if there is any questions. I'll just check through the chat. If you have any questions, pop them in the Q&A for me, and or the chat, because I'm just looking at both now. Good skincare with tyrosine inhibitor and Environ. Yeah, that was Galaxy. I think that's your phone, not your name. And there was just a question in Q&A. Let's have a look. What would you recommend if the client cannot tolerate retinoids? Honestly, Judith, amino acids and hyaluronic acid. So amino acids are your building blocks of collagen and elastin fibers. So amino acids and hyaluronic acid all day long. There are certain products from Shop Beautiful that contain those things. If we're going to talk brands, the NutriCross range is really, really good for anti-aging. And there's many brands on there. Again, you know, I'm Sunnycross girl as well, NutriCross girl, so that's where that comes across. But yeah, absolutely, retinoids are not the be all and end all. So get them on antioxidants, your vitamin C, your ascorbic acid, your prevention, your SPF, and you know, regular peeling would be really good for them as well to help increase that skin cell turnover. But retinoids aren't for everybody. And yeah, that's worth consideration, because it may put them off if you try and put them straight back onto that again. So yeah, I think that is everybody. Yeah, so I hope you've had a good evening. I hope you've enjoyed it. If you do have any other burning questions, then do drop me a message if you've missed anything. So I'll put my thing up, my tag on Instagram, so you can have a little look at that. I look forward to, so next week, so what the plan is for next week, I don't think I've put it at the end of this webinar. Let me check. No, I haven't. We will have a blog to follow from this. So there'll be kind of a bit of a dissection of what we've talked about in a bit more detail. And over the next coming weeks, we have plans to basically dissect the skin. So, you know, it's not, the webinars are probably not going to be quite as long, but we're going to be talking about each layer of the skin, how it functions, how it works, and the treatments and procedures that you can offer, and how it's going to affect that skin as well, that part of the skin. It's really, really exciting, a bit cellular level really, but not too complicated, just enough to get us by, to help us help our clients ultimately as well. Okay. I do hope you've enjoyed this evening. Thank you so much for joining me. Get out there and enjoy a little bit of sunshine with your SPF on. I've got my SPF on, even just sat at the computer today. And I look forward to seeing some of you next week. So don't forget to tag and share that you've been watching this evening, and do tell us what you thought and any other topics that you would like to see. We were always interested, and I would more than happily to help cover those with the guys over at Shop Beautiful. Thank you for joining us this evening. Enjoy the rest of your evening, guys. Do take care. Thank you. Bye-bye.